Good morning and good afternoon, everyone. Welcome to the Fibromyalgia Impact Tour. This is brought to you by the Healthy Voices Impact Fund, where we highlight amazing advocates around the world, making an impact in their community. So this is the first leg of the Impact Tour, and we'll continue on and talk about food insecurity, functional medicine, and quality of life for those living with fibromyalgia and overlapping autoimmune conditions. But I'm thrilled to have our special guest joining us today. We have the amazing Jenna Green. So welcome, and we're going to just start things off with some introductions, and then we'll get started with the interview. So I'm going to let Looms for Lupus start.
Okay, I'll start. Good morning and good afternoon, everyone. Happy Friday. I am Estela Mata. I'm one of the co-founders of Looms for Lupus, a nonprofit organization that my sisters and I formed to help those and support those living with lupus and overlapping conditions, their loved ones and caregivers. And I'm just excited for today. We have a special guest.
Hello, everyone, and good afternoon to some. I'm Juana Mata. I am the other co-founder of Looms for Lupus, and we're super excited to be here with Ms. Jenna Green, and we're super excited.
I know, it's definitely exciting. So everyone who's tuning in live, please let us know where you're watching from, and then we have special giveaways. So keep your ears tuned up for any of these notes as we go through the interview, but let us know where you're tuning in from. Give Jenna shout outs as you hear, and please get ready to be inspired with all the work that she's doing. We are welcoming Jenna Green. She is an MS warrior and founder of Full of Grit and Grace. She lives outside of Boston with her husband and rescue dog, Dixie. She's an auntie extraordinaire, which I love. I'm going to steal that for myself. Dog lover, caffeine addict, fashion fanatic, social media marketer, and business coach. Welcome, Jenna, to the Impact Tour.
Thank you so much for having me. I'm so honored to be here with you all. This is so fun. I'm like three of the most coolest women I know, and I don't have to leave my bedroom. It's magic.
I know I do miss seeing people in person and being able to give people our gentle hugs and stuff. But, at least we can continue this way to connect and highlight all of your work. But let's get everything started. So one of the objectives, as we mentioned about the tour, is highlighting advocates making an impact in the community. So what inspired you to start advocating for MS and other chronic illnesses?
Well, Melissa, that's a good question. When I was first diagnosed, it was about 5 years ago. I was 31, pretty healthy. I had some chronic pain and some nerve pain and pain issues, but I related it all back to a car accident that I was in almost a decade ago now. So I didn't really think of my symptoms as anything else. But then I had my first real MS flare up, as far as I know, and I was lucky to be diagnosed really quickly. And I have a great neurologist. I'm very privileged to live outside of Boston and have good health care, and we have great hospitals here. So I worked with my neurologist to decide on this disease-modifying therapy for my MS. Now, MS, kind of similar to fibro and lupus, is invisible. You can't see it. It affects everyone differently. It's called a snowflake disease for that reason, although I prefer unicorns because I don't really like snow. And it affects all types of people. They have no idea why. They don't know what causes MS, and we don't have a cure yet. But we do have now over 20 disease-modifying therapies, which are designed to slow the progression of this disease. And it's an autoimmune disease. It's neurological, and essentially your immune system starts attacking the coverings of your nerves, your myelin. So it affects you from head to toe, because the nervous system goes all the way up and down. So the symptoms can be very varied. They don't know which medication is going to help you the most, but there's a lot of statistics. So with that in mind, I worked with my world-renowned neurologist, did all my research, and decided to go with one of the higher end in effectiveness infusion medications. So you got every 4 weeks. And so the first day that I was signed up to go, I was like, I thought everything was going to be fine, and I'm going to go back to my regular life like nothing happened. I was still in a lot of denial, but the nurse called me that morning and she said, your insurance didn't approve this medication. They said that you have to start on a less effective medication and have that fail you. And then you can maybe move on to this one. And I was like, so they want me to have possibly permanent brain damage and degenerative disability, rehab, hospital stays, steroids, all these things. And then maybe I can move on to this medication. And that's known as step therapy. It's apparently very common, not just for MS, but for a lot of chronic illnesses and cancers as well. And I was like, oh no, you don't know me. This is not going to work for me. And I was young and stupid then, okay? This was 5 years ago, but I can say I was young and stupid then because I had no idea how this all worked. But I was like, that is not going to work for me. So I went in. I was like, you bill me this 20 grand. You just bring it on. Like, I don't have 20 grand. I didn't have 20 grand at the time either. But I was young and stupid. And I had experience in the healthcare system. I had experience being blown off by doctors. I had experience being told that my pain was just because of my weight and to do more yoga and whatever. But, surprise, I lost weight and I still had chronic pain. Like, the medical system is obviously screwed up. But at that point, when that happened to me, I realized, having a background in social media marketing, I had a social media marketing business at the time. I was self-employed. I knew I had a privilege, and I knew I had a platform, and I knew how to use it. And I knew that I had the support of my family and friends, and I was super grateful for that. And I know not everyone does. So I thought I hadn't shared my diagnosis publicly yet. But I was like, this is all right. This isn't going to work for me. I'm not going to shut up about this, because I know that there are people out there not nearly as privileged as I am and that are going through this exact same problem. And to this day, we are still fighting for step therapy to be removed, that policy to be removed here in the state of Massachusetts and across the country. It's going to pass this year. This year, it's going to pass. If you're in Massachusetts, please contact your legislators. I can send you a link. I can put it in the comments afterwards, because we are currently trying to get support for that with the MS Society and with the National Cancer, a whole bunch of organizations. We're all trying to pass that legislation here in Massachusetts. And I know Shane will ask for your support if you also live in Massachusetts.
Well, and we've been working on for the California group as well. So I think the Arthritis Foundation. So I'm learning more about step therapy. I know Stella and Juana have more experience, so they brought me in to learn. So I've seen the advocacy work that needs to get done with that, and just what we need, because I don't even know if I went through that. So you were experiencing that that's a lot of like money to even process for 20 grand. And especially being younger and not knowing, and this is what they throw at you at a younger age too. And it's like, you're either too young to be that sick, or they give you this other alternative and just try to confuse you so much more.
Right. I mean, still to this day, like, people say, but you don't look sick. And I'm like, well, thank you, but that's not a compliment. It's extremely ableist. And either you're calling me a liar, or you're saying that, disability makes you ugly, which is, again, ableist. So I have, kind of expanded my advocacy to include the awareness of invisible illness and trying to change public perception and public policy. And if you hear the grumbling in the background, that's Dixie. She's not my dog. She's not as pleased about this interview as I am, but she's excited in her own way, in her own, I wish you were snuggling me in the bed way.
And it's great that you're bringing awareness not only on step therapy, but also, talking about how important it is to self-advocate, especially when you go to the doctor and there's so many, what the doctor tells you and you don't agree, it's important for you to fight for what you believe in. I mean, I'm alive because I had to do the same thing. If I had not advocated for myself, I wouldn't be here today. So it is so important for people to realize the importance of advocating for yourself. When you go to the doctor, we know and we respect the doctors, but we know what we're going through. We know the pain. We know that there's something wrong with us, and we need to continue to educate others, bring awareness, to speak up, to let the doctors know when they know that there's something wrong with them.
Absolutely. I couldn't have said it better myself. I mean, we know our bodies better than our doctors do. They are well educated. I respect them, but my friend who is the Sparkled Life on Instagram says that you are the CEO of your own healthcare team and you should hire and fire accordingly. And I love that because it's so true. You're the boss. You're in charge of your healthcare, and it can be very hard to speak up, especially when it is so very overwhelming and you are, not feeling confident in what to do. So absolutely, just keep speaking up for yourself.
Right. And about step therapy, the importance too, because again, doctors or insurances are telling us start with this medication, knowing that it could even make it worse for us as patients. And so we definitely need to continue the fight to pass any bill that will help the patients and not going through step therapy, which could at the end be more costly and damage our health.
Absolutely. It's more costly not only for us as patients in a physical way, but also for the insurance companies in the long run. It doesn't make financial sense, which is why I can't understand why it's still a thing, but it doesn't make financial sense for them. It is better for them, for us to stay healthier, to be healthier, to have the most available medication. And yes, the step therapy bill, we're going to pass it this year, 2021. It's the year.
I hope that we do. We are also working over here, Jenna, along just like you, on passing, hopefully getting more stories, patient stories, bring more awareness, and have more people help us, talk about this, because a lot of people don't know what step therapy is. They don't know if they're going through it. So I love that not only do you raise awareness for this invisible illness, MS, but also the way you explain it and the way you kind of share and you make us all kind of be a part of this, because at the end of the day, it affects us all. I live with fibromyalgia. My sister lives with lupus, RA, and so many others, Melissa with fibro, and you don't see it. If you're looking at us, you don't see it. So I love the way you explained everything. I love the way that you took initiative and you're like, this is not going to just stop here. I'm going to share my story, even though I haven't shared it yet with anyone, but I'm going to share it to help others and empower others and make a difference, not just for me, but for everyone else there in Massachusetts. So that's amazing. So I love the way, what you're doing, but can you share with us some of your favorite projects that you have worked on so far?
Thank you so much. That really means a lot. Well, the step therapy bill is probably one of my favorites. I actually testified at the Statehouse on a similar version of the bill back in 2019 when that was a thing. And then, of course, unfortunately, it got kind of pushed off because of the pandemic last year. But one of my favorite projects was participating in the MS Public Policy Conference last year and this year, although this year was virtually. Last year was in DC, and I got to spend 2 days with some of my fellow advocates and hug everybody. As was pre-pandemic, there was a lot of hugging. There was still hand sanitizer because many of us are immune compromised from our medications. And I wore a mask on the plane before it was cool. But, that was a really amazing experience for me. It was super empowering because, I think as patients, a lot of times it feels very disempowering and the system feels so completely out of our control. And our bodies feel so completely out of our control, and you lose trust in whether or not, you know, your left leg is going to walk with your right one, or if your right arm is going to, you know, have searing pain, or your feet start to twitch, or whatever, or you forget all the words, you know, you lose control of your bladder at 35, you know, you kind of, it's disempowering. But the advocacy and doing things like this with all of you, you know, while we all live with different conditions, we all have the same goals, which is to, you know, better help the experience for everyone, you know, to make it better, because these diseases, they suck. 0 stars, you know, don't recommend. But the people that I've met because of it, that's, I mean, that for me has been priceless, and that's what kind of keeps me going. So yeah, being able to meet everyone last year in person and have those in-person meetings on Capitol Hill, that was truly one of my favorite advocacy experiences. You know, but I've been privileged to have so many great times. I'm sure this will be in the top. You know, I've had some really great meetings with senators and representatives, as well as you're working with various companies to make things more friendlier for people with various, you know, disabilities and health issues. You know, I worked with a company to make these little phone handles that are easier for me to hold my phone, and we have a line of them. Oh yeah, Melissa has one. I have one. This one says advocate. It's called the love handle, which I think is hilarious. And
I want one.
well, message me your address. I have a couple still here. I have
my regular love handles. The real love handles. But I would love one of those love handles.
You're gonna have to send me your address. I will send you one, I promise. I have some left over that I was supposed to give out in person at the Healthy Voices conference last year. But of course, we had to do that virtually as well. So I'll mail it to you now.
Well, that's awesome. I mean, it's such a great treat. I got one of those too to support your campaign as well. Let's do a quick check-in. We have a lot of people tuning in. So Lupus Boons, hello from Chicago. Amy's tuning in from Baltimore. Lisa, Ontario, welcome. We have Andrea from Albuquerque, New Mexico. Oh my goodness, that's making me hungry before at breakfast. Carrie is tuning in for Taiwan. Carrie is amazing. I just talked to her last night, so I don't know what she's doing up. And we have Crystal is also. Hi, Crystal. Hello, everyone. And we have some good comments here about step therapy being absolutely horrible. And then Carrie said, yes, we must advocate for ourselves. We know our body's the best. We have people that love that. We are CEOs of our bodies and health. Shayna wants a love handle. Candace, you need to get in touch with me. I'm trying to reach you. So she pops on. I definitely. So these love handles are going to be popular. And then Darlene from New Hampshire. But this is so fun because, you know, I think what happens is sometimes we limit ourselves in our conversations to just people who are diagnosed with what we have. But you've talked about things that all of us can relate and what we need to like work on together. So that's why I'm just enjoy these conversations with all of you, because there's so much that we can also accomplish together, and we can relate together and support each other because we're all in this. And especially with something like fibromyalgia, sometimes it's like you get that diagnosis of fibromyalgia and then the doctor stops looking, and you know, you don't know whether, and you show some antibodies, you have neuroinflammation, but then they're like, oh, it's just your fibro. So we can really learn from each other when it comes to all of this. And that's why it sort of leads into the next part of my 2-part question for you. Just have you noticed anything? So we talked a little bit about step therapy, but what other programs have you noticed that you want to see more of in the communities or need improvement?
Oh man, I could go on for a while there, Melissa. I don't get out much lately, so I told you talking is my favorite activity.
Well, that's awesome. We welcome that. So,
I think the pandemic has certainly highlighted a lot of the inequities and issues in our healthcare system that I knew were there because of my personal experience and because of the community, the general experience that people in the community have told me. So I wasn't surprised, unfortunately, but I think many healthy, able-bodied people were a little bit surprised and taken back by how our healthcare system actually works and how, systemically it is terrible, racist, inequitable, not designed to help people, not designed to cure patients. I could go on, but that I think it's a huge issue. It's a huge issue for everyone, not just people with chronic illness, but I mean, disability and chronic illness is the one thing that it's the one marginalized group that everyone in America could become a part of tomorrow by no fault of their own. I'm a white woman, like I said, with privilege to have health care and live in a liberal state that promotes good health care and has great doctors. And we do a lot of research here. And it's wonderful in many ways, but that does not mean that anyone can't become a part of a marginalized group like tomorrow. I think people don't realize that everything could change on a dime because it hasn't happened to them. And in so many ways, we don't wish that on anyone, right? Like, I wouldn't wish this on anyone. But I think we really need to continue to highlight these inequities and not settle for just small moves forward, small moves forward. Just stay home if you don't feel safe. Or, I was privileged enough to get a vaccine appointment on Wednesday. And, it was advertised as accessible, but it was not accessible. No, that was not my version of accessible unless I did because I needed it. Had to request a wheelchair and someone to push you, but that means you're you're very close quarters with someone who you don't know, who is masked and probably vaccinated, but as an immune compromised person who hasn't been near, really anyone in the last year, I was like, what is happening here? This is not, I was like, wait, you mean I need to walk 5 miles and then walk up 3 flights of stairs? I was like, yeah. It was the end of the day and it wasn't going to happen. I think we really have to redefine what accessible means because it's not equal for everyone. It's not the same. I say equity and not equality because what I need may be different than what you need to live a good life. And both are valid. Both need to be addressed. I think within MS and multiple sclerosis specifically, I know that most people think it's an old white woman's disease. And, I am a stereotypical younger white woman, I joke that I'm 98, but I look good for my age, but I will be 37 in a few weeks. But, I'm not like exactly like someone's grandma, Auntie extraordinaire still. I stand by that self-defined title. But MS affects all kinds of people. It affects BIPOC, men, transgender, LGBTQ, everyone. And because of these stereotypes that are passed down from doctors and family members and people not feeling comfortable, rightfully so, speaking out and sharing about their illness because it's invisible and people think that no one that looks like them has it. It makes it so much harder on those people. And I know that we're working towards more equity and inclusion, but we have such a long way to go. We just have such a long way to go. I don't have the answers for it. I wish that I did. But I know that I'm not going to shut up about it.
Well, we appreciate that because it's also connecting with organizations that are also doing the work on that front. I mean, I've noticed there's a lot of conversation, but I also say like we also need to take action to make those changes and what that looks like. I mean, there was so much to what you said that it's like piecing out and taking apart, and it just triggered me too with the vaccine sites because there's actually no like when you get a confirmation, even at the end, because I was thinking of going to Cal State LA. Like if you make the appointment, I haven't seen from other people's thing, like, do you need any assistance trying to get there actually in the confirmation? So yeah, like what do you do? I mean, they're opening it up to now, people, all kinds of people who are going to show up at these mega pod sites if it's not drive through, which is a whole other complication. And you have to like I mean, we have lots of hills in California. I mean, Dodger Stadium too is a big ravine with like, it's not fun to walk at all. So, I mean, like that just reminded me too, is like these little things that people forget. And it's important and it makes a big difference too.
Yes. Tagging on to that really quick, Melissa, my sister and I were so lucky. We went into a drive-through. So we scheduled it. My husband drove me, but I could drive. Not everyone can drive, but I went through the drive-through. I didn't have to get out of my car. I was, in the passenger seat. I just gave my shoulder. They gave me the shot. I waited for 15 minutes and I came home. I was in there only for 30 minutes. So meanwhile, you go through the line and the waiting time. So I was lucky. So, I wish that they would, actually let people know like this is good for someone that can have someone drive you through. This is a drive-through, or this is, in a building where you are going to need, some help, or if you need assistance, be prepared. So I wish that there was that, maybe hopefully something, people start talking more about it, and then, it goes up. I know right now they're opening it up to everyone, like April 1st, I think, over anybody over 50 here in California, and then anybody after April 15th, anyone over the age of 16, I think. So it's like all these people with many conditions, some that are in need of assistance and some that may not be, but how do you know what location to choose, or if there's even accessibility for those that need the access. So it's just, I think we're realizing, and everything you talked about, Jenna, I agree. And I think the more we talk about it, hopefully there's more solutions. Oh.
Is Estella frozen or is it just me?
I think Estella's frozen.
Okay. It's hard to tell like everyone out there with the technology, but I mean, these conversations and having these conversations on actual health equity. I'll have to pull up. There was a great graphic about this, but this leads me into then the next part of the question. Oh, Estella's back is okay.
Was it me?
Yes.
Oh, I was freaking out. I thought it was all of us, and I'm like, oh no. Okay.
No. Okay. So when we're talking about these things and making these changes, like, did you have any advice or suggestions then on how we can better work together?
As far as like talking about all these things, I think if we reach out to, locally, we have the assembly members, right? We have our mayors, we have our assembly members, we have our local senators, and then you could go above. So I think this is more like obviously it's a huge issue for everyone, but if you start locally, like what your needs are, and you go to your local mayor, find out. So here in Baldwin Park, where I live, I know there's a senior center that's offering these vaccines. And I know because, it's a senior center, they usually have accessibility and stuff. So I would probably say, look first at your local facilities. If it's like a senior center versus if it's a park, probably would also be accessible. So just look in your community first before, like I wouldn't reach to the legislator for this. I would reach someone locally. Let us know also if you're here in the San Gabriel Valley, we have, a lot of connections. So I think talking about it locally first, finding out what it is that you need, and then who you can talk to. And then, obviously, if you don't get the help that you need, then we could just, push it a little bit further. But a lot of the local offices, for our assemblywomen or for our mayor, they're there to help. That's why they have their desk jobs and their phones, and they're ready to help you. So I'm thinking go locally. That's one of the things. And if you don't get the assistance that you need, then, let us know, and then we'll figure out how we can help you.
Well,
That's such great advice, really, because, we're all in this together.
Right. Darlene Thomas is saying that the nurse offered to come to her house, but she's afraid to get it. That's great.
I can understand. I mean, I had some fear as well. I think a lot of us have medical PTSD. And I know, again, I have white privilege and I haven't experienced the same discrimination from doctors as many other people have, which is, one of the reasons I wanted to share about my vaccine experience and get it, and, let other people with MS know what my experience was like, because, all of our diseases are unpredictable. And so we make very calculated risk decisions, I think, in our medication choices all the time. And this, for me, was a calculated risk decision, and advised by my doctor. Always, of course, speak with your doctor. I wouldn't recommend that anyone, I'm not a doctor. I just see a lot of them. I collect them like Monopoly pieces, but I am not a doctor.
but we are the CEOs, so of our own bodies.
Right? I am not a doctor. I collect them. I'm the CEO of my own body. But I can understand the hesitation. I don't blame you. But for me, having lost people I know to the disease, and the advice of my doctors, and knowing that I'm high risk, and my disease modifying therapy that I'm on now makes me both immune compromised and at high risk for upper respiratory infection. MS does not inherently make you immune compromised, just it depends on your medication. So I did go within the timeline of what my doctor recommended for getting it in between infusions, because now I only go every 6 months. So I'm just fingers crossed, and knowing that I'm doing the best I can with the information I have at the time, and that's kind of how I look at everything in my life, because I've certainly made a lot of mistakes. There are certainly a lot of things that I've had to mindset wise get over. Stop blaming myself, forgive myself for. We're always our own worst critics, unfortunately, I think. So I just that's what I try to remind myself. I'm doing the best I can with the situation at hand and the information I have right now. And that's the best that you can do. And there's, no judgment here from me. I totally understand.
Well, and that's what we have, it's being kind to ourselves and having some compassion. And especially right now, after everything we were going through all together, is really understand, that positive self-talk to ourselves, and just being kind, and really reaching out to the community of people. To anyone out there that's watching, we have 3 amazing advocates right here that you're talking to, that you can follow and, find some comfort in. There's a bunch of people too who are chiming in. So reach out. Like, this is a really great community to just lean on and find information and know that you're not alone. But I know that I'm going to let Juana bring in the fun. So we're going to switch it up a little bit. Like, we'll get to the slide deck because I have some pictures from you. But I thought I'm going to let Juana talk about some fun stuff.
Yeah. Now that, we're going to be switching gears up with because this is a road trip. So Jenna, what are your must-haves on a road trip? So just imagine that we're together in a tour bus. What can we learn about you?
Well, we will have a lot of fun.
Definitely.
I love this idea. And I love that it's like a tour bus because, I can't really sit still. So I got to get up and walk around. Can't sit for too long. Can't stand for too long. You're going to see me. First of all, you're going to see me doing stretches and laying on my acupressure mat in the middle of the tour bus. Like random times, I'm just going to be stretching it out and foam rolling. And I got like a Theracane thing for the spasms in my back. And you're just going to be like, oh yeah, Jenna's just doing a weird stretch thing again. Okay, cool. I do not travel lightly. I'm very high maintenance. Gotta have a lot of meds. But most importantly, we gotta have snacks. Right? There's gonna be snacks on a road trip.
Yes, of course. There's always snacks.
Snack?
So yeah.
All the snacks. I'm gonna need all the snacks.
I love it. All
the snacks, right? Because it's a road trip. What else do? You eat snacks. You gotta have all the snacks. Definitely popcorn. I love popcorn. It's like such a good snack, right? You gotta have like some salty and some sweet. I've been like trying to lay low on the dairy, but like maybe some fake vegan M&Ms or something. I found some like decent dairy-free chocolate. It's all right. It's okay. It's not the same, but
Well, you guys are going to have to be patient with me lugging around my avocados. So I definitely travel with avocados. I've been stopped at multiple airports, especially Boston and any of those, because my bag gets pulled all the time because the screeners are like, what does she have? She has like 10 avocados in her carry-on bag. So I get stopped. So
oh my God, that's amazing. I'm down for let's make guacamole and we'll have tacos. And I mean, like, yes.
We'll definitely have to have then a little grill, like so we can make
or just guacamole and chips. That's all.
Okay.
Right?
Sign me up right there. I'm down. We need a little lime though. Like I'll take what I can get. Let's but if we go out can dream, right?
I think this is by far the best road trip because you talked about popcorn, my favorite. I can't have a lot of it because I have kidney stones, so they trigger. But I'm willing to take the pain every now and then and have some popcorn. So I love popcorn. I love chocolate. I love all the good stuff too. So guacamole, I'm good for that. As long as it doesn't have onion, or I'll make my own. But yeah, we need the lime. So I'm loving all this.
Yes. I have enjoyed these new chickpea based snacks. They're called like hippie peas. I don't even know how you say it. I just call them my hippie snacks.
I know
they're pretty good. I mean, it's not popcorn. It's more like a Cheetos substitute, but it is like gluten free and vegan, and it's it's pretty good. I can get behind those too. I can. But I always buy like small bags of the popcorn because otherwise I don't.
You don't stop?
No,
I don't either.
It's bad. Always like the individual ones, always the individual bags. So I know that I didn't eat like 5 buckets of popcorn. Let's, and I don't even have kidney stones, so let's just.
There's some bags with
size snacks for everyone. And we gotta have like a good podcast playlist, a good music playlist, so we can.
Okay, so what are we listening to? Are we going to be fighting over the radio or fighting over the playlist, or we're just going to make a playlist combination? Like, what?
I like all kinds of music, like happy music. Let's not have unless we're going to have like a cry fest, I mean, sometimes you need a good cry fest, but otherwise, let's have some upbeat music. I'm down for all the upbeat music, pop music. I can even do a little country. Apparently the music I like now is on the oldies channel. I'm old, but I'm 98. I just look good for my age, And I've been a big fan of podcasts, especially since the pandemic, and I don't watch as much TV. There's nothing good on TV. So I've been listening to a lot of podcasts. I like inspirational stuff. I do listen to some MS focused one, like Myelin and Melanin is a great one with two of my friends, Dawn and Dana, are run that podcast. Two Black women with MS, Myelin and Melanin. And, but I also like some like woo-woo out there kind of stuff, like manifesting, and I've been learning about tarot cards and crystals and like just for fun. It's fun. And, I like to combine it all.
Well, that's where we need this advocates tour bus. And it looks like Crystal's going to bring in the karaoke machine, and we're just going to go see, we got to do this. So this pandemic's got to end so we can do an advocacy tour and pick everyone up on the way. All our We Go Health Awards people, and just, bring them on board. There's so many advocates around the world. I mean, we can't hit the world because we can't drive there, but at least like the US, we can like make it maybe when they come to visit. But that's awesome. So we'll be singing Up a Storm, and you guys will have to put up with my music, but we got it going. I love it. And all the snacks. Wait, was it corn nuts the Looms for Lupus is going to bring?
We'll bring popcorn, corn nuts, and all the snacks.
Sunflower seeds. We love all of that.
Awesome.
Do you mind the gum popping, Jenna?
No, I think I'm fine.
Okay, good. Because we pop our gum.
That's not going to bother me. It takes a lot to really bother me. Like I'm pretty, I wouldn't say that I'm like laid back. I have no chill, but I don't really I'm not chill. Like I will scream and like hug you. I'd be so excited, but like, nothing really bothers me. You gotta have really, is there a bathroom on this bus? Like I gotta make sure though.
That's a big thing I've been debating about, because can we handle that? Like, or do we just make stops? Like we make stops through
we're gonna have to stop a lot for me. Like, I mean, I have found
one in. I say we get a tour bus with the bathroom already ready for us.
Yeah.
Like,
Yeah.
I have the bladder also of a 98-year-old lady. So, fun fact is that 70% of people with MS have like a bowel or bladder issue. And, it's not a cool thing to talk about on the internet. And the incontinence pads that you find at the store are not sexy
Right.
at all. And they don't make you feel like they make you feel old and uncomfortable. I like the Sneaks underwear for the incontinence underpants. Those are my favorite. They're kind of expensive, but, I'm just saying, girls gotta have her priorities, because we're gonna eat all these snacks. I'm gonna get thirsty, and then I'm gonna have to go to the bathroom 500 times. And you guys are gonna be like,
"It's a good reminder." Maybe they can sponsor the tour. We can have they could be a sponsor or something.
Yes, like incontinence underwear is sponsoring our tour. Like that would be amazing, because I could really use more of them.
I mean, we need to have these conversations and be open about it, because this is real life. I mean, when I was struggling with stomach issues and more of the IBD, like it's embarrassing to have these conversations. But I like jumped over like children just to get to the bathroom, because it's like, move.
But it is so important to talk about it, because I mean, why should we be embarrassed for something that we're going through? Just with our conditions, they're invisible, and so we need to bring this up. I mean, we really definitely need to talk, and we shouldn't be embarrassed. I mean, if we need to wear whatever we need to wear to be okay, then,
And it's a natural thing. You have to go. And if you can't control that you have to go now, then, it's okay to say, hey, I can't wait. I need to go now. And I think the way you said it was so perfectly, Jenna, is, I need this, and we're going to do this. I need this, is knowing that it's okay to say what you need, because, if you don't, then whoever is with you is not going to know what your needs are or how they can help you. So I think that's like super important as well, because sometimes it's good to obviously raise awareness, but also let whoever's with you, your friends, your loved ones, what you need, because sometimes you don't need them and sometimes you do. And in cases like this, then, just be prepared. I'm going to need to stop several times. Just like I will say, I'm going to need some of my tapatio for my popcorn. Not that I'm comparing it, but, those are just like stuff that we can talk about and say, hey, this is what I need. So I love this whole conversation, but I know that, Melissa, you have something coming up.
Oh, well, we're going to get into some of the slideshows, but I like this because what I've been having conversations with other people, and especially when you're in your 20s and 30s, and you're talking about some of these things like incontinence pads, or just even asking for things when you are going out. And so I just recently had a conversation with someone, and it was like, well, I didn't want to ask for this. I was like, no, you can, like, if you're going to a restaurant or you bring something to sit on, and you like, just we're all in this, we all do this. So being okay with who you are, no matter what age, if that's what you have to do at 30, then that is what you need to do, and let's make you feel comfortable with it. And you're a part of our community, so we all get it. We've all been there.
It's definitely easier when you're with people who get it. It's certainly harder when you're not with people who get it. But that's why road trips with you guys would be great. I'm down.
I know, and we have some brainstorming in the comments we'll have to get to shortly, but I wanted to make sure to highlight the amazing work. So we put together some of the slides of the pictures you showed me. This is you. I mean, I know where this is at. So why don't you walk us through a little bit of some of these highlighted images?
Oh my goodness, this was a great day. This was March 2020, like March 1st or 2nd last year, right before everything shut down, at the MS Society Public Policy Conference that I had mentioned earlier. It involved a bunch of district activist leaders and also government relation action committee members, which most of us are just volunteers living with MS, as well as, of course, some people that work for the MS Society and work in advocacy. And this was at Senator Elizabeth Warren's office in DC with one of her staff members, who was great and super open to our hearing our stories and listening to what we were asking for. And I think that's really what, for me, I mean, when I first showed up just one day at the MS Society advocacy, like I signed up for the emails, and, I joined We Go Health, and I started following some awesome advocates like Melissa, and I thought, okay, well, I don't know how to be an advocate. Well, you're literally just telling your own story. And it's so powerful to know that your story can make an impact on laws and legislations, because senators and their staff members, they get, all these bills past their desks and whatnot. And sure, there's a lot of information there, and sure, they can, put testimonials and things as to why it's important and why we need this to move forward. But when they hear it from someone who is living with it, and it will actually impact them, and there's someone, especially from their state or their region, it makes a huge difference. And I really didn't know that at first. Like, I didn't realize that telling my story was advocacy. I just was sharing what I was going through, and I didn't want to feel alone, and I really didn't want anyone else to feel alone, because I knew that, again, like, I was privileged to have good support. But when you're not, you've never been through it, and even if it's a little bit different, and it is for everyone, it's better to be supported by, and to feel like you're not alone with people who can understand. So this was like a banner day for me. They also gave us all scooters, which was fun. I scooted around the Capitol because, I mean, it's a lot of walking. It's a very large place. But it was accessible, and then my scooter died like right at the end, right before we pulled into the bus. So it was like amazing, like really good timing. Thank you, universe, because I would not have been pushing that scooter around Capitol Hill. When they say hills, they are not kidding.
Oh yeah.
this is that same day. I do have other clothes. It was the same day.
Well, you're really in there. I mean, that's why I just love what you were saying too, because everybody, like, we want to include a lot of different people. It's not just for a select few. I mean, I know it can be expensive to go to Capitol Hill. That's why having now this hybrid of virtual with people in there. But I just love this. And I love how you were able to know that, you can make a difference. And this picture with you in the meeting too there, like you are in the moment and really getting into it. So yes, take us through this.
That was on the right was my very first meeting of the day. It was my first meeting ever on Capitol Hill. Had met with legislators here in Massachusetts before. Like I said, I had already spoke at the Statehouse, although I don't have any pictures, I don't think, from that day, so I didn't give you one. But I was there. That was my good friend Aya, and I was nervous. I was like, oh my God, I'm gonna throw up. And then she's like, you've done this 100 times before, and I'm like, but it's Capitol Hill. She's like, they're just regular people, and they are, and they're so nice. And she's like, you've spoken with them, like you're fine. So, but I was talking to them about budgets and the information that we were trying to pass. We're talking about we were talking about telehealth again, before telehealth was really that trendy, and the importance of it for people, especially living with disability and chronic illness, which we're still trying to continue nationally with the MS Society and a few other organizations, as well as funding for continued research. Fun fact, the Department of Defense actually does some of the high risk, high reward research for multiple sclerosis, because there are over 70,000 veterans living with multiple sclerosis. Which it's not exactly a fun fact. I think I may have prefaced that wrong, but so it's interesting as to why we're asking for money to support the Department of Defense from the MS Society. I realize that it doesn't make sense, I don't think, unless you can connect those two dots. Thankfully, we'd had 2 days of talking about these issues and talking with other advocates, and so I did feel really comfortable and obviously really passionate. And I'm Italian; I talk with my hands. So I was talking with some staffers there, and then a little photo shoot in front of Senator Lynch's office, who's always been a big supporter of our needs here in Massachusetts. He's co-sponsor of the original continuity of care bill in 2019, and very supportive still of everything. And I have my cane is sparkly, and then it also folds up, which is important when you have varying disability. Like, you need different mobility aids for different days and different times of day even. So that's handy.
Yeah,
so I had it with me, like in the cart of my scooter. So like when I wasn't using the scooter, I had my cane in case I felt like I needed it, So we had a little photo shoot there, and it was a very proud moment for me.
Well, we're definitely going to have to get the name of the cane and other information. But yeah, just their passion and showcasing this work and letting other advocates out there know. I mean, I've learned so much from yourself when you were sharing those pictures. I think we just missed you in March with following up right after you, and then learning from Juana and Estella. I know Juana was involved with peer review for the DoD for lupus, and then Estella and Juana had been there for lupus. So this is great to just showcase all of your work, and then being at Capitol Hill, doing this and talking with your representatives and making it more attainable for others. Like, how do we get more people involved? I mean, do you have suggestions? I mean, you said you weren't sure if it was going to make a difference. So was it just the fact of like being there that helped you transition, or did you what kind of went into your mind to try to make the first step forward?
I think, I wasn't sure if it was going to make a difference. It was prior to me being in DC. That was like my first event. I wasn't really sure, I was very hesitant and wasn't sure what to do. And I know nothing about politics, and I still have a pretty limited political understanding. I mean, it's complicated, right?
It is
But
complicated.
I signed up for the MS Society activist emails, and they were doing a activism event, our state action day in Massachusetts, and I happened to be able to go that day, so I kind of just registered and signed up, and it was free. And that was the day that I was like, I don't know if this is going to make any difference, but it truly did. And I got to speak with legislators that day. Senator Lynch actually spoke that morning before in our main group session, and I learned a lot, and I felt very prepared. And then we were able to go and talk with legislators all in that day. And, now we're doing that virtually through the society. So now you can be an advocate from your couch, from your bed. I did, I advocated from my bed this week. I sat in my bed and listened to the MS Public Policy Conference, which thankfully, because it was virtual, it was actually open to everyone this year. So we had over 1,000 people attend. We're also going to have a virtual state action day in Massachusetts. Many of the state action days through the MS Society have already happened this year, but in Massachusetts, ours will be in May. So regardless of where you live, if you have MS and you want to get involved with advocacy or learn more even, you can just go to the Society's website and sign up for the advocacy emails. They have a great system. It's like magic. That's like 2 clicks and you can be an advocate, like 2 clicks. Right now, we're asking for support for funding for research from our representatives nationwide, and we're asking for support of telehealth, continued telehealth, continued access, expanded internet and things, so people who live in more rural areas can access telehealth, because we've seen it makes such a huge difference. I mean, personally for me, it makes a huge difference. I know for a lot of other people with chronic fatigue and chronic pain and mental health issues, being able to have a teletherapist and not having to drive there every week is amazing. Besides just the health risks of going out right now. Right now they have, there are 2 clicks. I'll put them in the comments afterwards. Anyone can click and it will give you information about the bill, and then you fill in your name and where you live, and it contacts those people for you. It has their emails already in there. There's a pre-written template. You can add to it, you can change it, but you can literally just do it as is, send it as is, and then also gives you the option to like tweet it if you're on Twitter. I prefer Instagram, but I do have a Twitter, so I can tweet at my legislators. And it's great. It's literally advocacy in 2 clicks. You don't have to go to the State House or to Capitol Hill to be an advocate. While it was super cool, I mean, like, totally recommend it. And that is the Public Policy Conference is actually funded by a private couple. Actually, I believe it's a couple that funds the travel for advocates to go to that event. So it is limited, but it's not funded by the MS Society itself. So it was an amazing opportunity for me because, of course, like you said, that would be very expensive. And even just to take a day off and go on into the State House with parking and buying like an $8 bottle of water or whatever, I mean, that can certainly add up too, but you don't have to spend any money in really truly just 2 minutes of your time to be an advocate in making legislative change. But like as Estella had said earlier, the advocacy that you do for yourself is that's where it all needs to start. I think is advocating for yourself, advocating with your doctors. That is the most important form of advocacy. That has to start with you, advocating for yourself with your family and your friends, advocating for others when you see inequality. I say as a white woman, we need to do better as white women, white people. We need to educate ourselves, understand unconscious bias. We need to understand our privilege. Privilege does not mean that you haven't had a hard life. Privilege does not mean that I don't have MS and a disabling degenerative disease with no cure. I mean, I do, but I still have privilege. And I think people they don't understand that the meaning of that word. And so, I think, but I've had a hard life too. Like, I don't have any privilege. And well, you haven't had a hard life because of your skin color or because of where you grew up or because of, because of your name or your race, like or your religion. Like for me, that is just, that's something that we have to continue to talk about and raise awareness for. And I don't know how to change the world just yet, guys. I'm working on it.
Well, if we do it together,
we
that's
gotta do it together. Yeah, that's the thing. Exactly. What we're doing right now, talking about this, raising awareness for these issues, acknowledging that we've all made mistakes. And we're gonna forgive ourselves for those, and we're gonna learn and do better. That's what gives me hope. That's what gets me out of bed,
Well, and for mayor, one of our little, the slogan is community takes over. And I really want to emphasize community and working together. And I also saw from Lupus Spoons that she wants to know more about MS, and then she wants to learn to contact her reps. And so, we already got her. She's going to be, I think with lupus and all of this, you can see how we can all help each other. And we're doing stuff with proclamations on April 3rd for May, but we're all working together. So we invited the people. So that's what we are moving forward on.
Right. And I'm here to support lupus and fibro. I'll sign your petitions and tweet my legislators about that too, guys. It is all for the greater good of all of us, even if it is something that's specific to one disease. This was a very cool day. I was I guess this was 2019, the end of 2019, I was named Emerging Activist of the Year from the MS Society in New England. And it was a beautiful luncheon, and I spoke for a few minutes about, the importance of using your voice for advocacy and, joining us as advocates. And I got a cool little plaque, and I was like, wow, this was very fancy. I didn't know that this was a thing, So of course I take a lot of silly selfies.
Well, and we have, that's congratulations. You're going to have to share a little bit more about that, even in the comments, or is that somewhere we can read more about, your award? And
oh gosh, I think I might have a recording of it posted on my Instagram, probably from 2019. It feels like forever ago, but it was certainly a highlight of my advocacy journey. That was really the first year that I got very involved with the MS Society. So I guess emerging activist is new activist, right? So that was kind of the first year that I got more involved in a volunteer basis. And I still volunteer. And while we all have limitations on our energy and our time, I think for me this has been such a good use of both my energy and my time, because like I said, it helps me feel like, this disease sucks, but at least we're going to make it a little bit better for people. We're going to make life a little bit better for people like me, and, not just people with MS, but people across the country. Last year, one of our biggest things that we were talking about in DC was also about disaster preparedness for people with disabilities, which of course, thankfully has been increased, and that a lot of that type of legislation is passed in the past year. So it's, not a current ask right now because we got it, but when you make that difference, the day that the step therapy bill passes here in Massachusetts, I'm gonna pop some confetti in my bed, maybe, because it might probably still be a pandemic, but there's gonna be a serious party, because I just think that is so empowering, and it's so important to realize that your voice really does matter, and your story matters, and your experience matters. And I can't speak for other people. I can't speak for other people with MS. I can tell stories that I've heard from people who have shared them with me and said that it's acceptable to share, but everyone's experience, like I said, is different. And the more people we can get involved in sharing their story, and the more people that feel comfortable and supported to do so, I think the better. That's why I love this.
Well, and you can inspire other people to share. And so that's why it's like we included the advocate warrior, because you also have full of grit and grace. But I mean, I love your t-shirts and stuff like that too. And particularly there is a mug that I'm going to grab because it says caffeinate. What is it? Caffeinate first, then advocate. So I was like, oh, that's so me.
I mean, I love coffee. So I do have a cute little line of advocacy swag and shirts and things, and this canvas, and that shirt is on there. And that mug is pretty awesome. I am cutting back on the caffeine, which has been so hard. Cutting back on coffee specifically. I still have caffeinated more green tea, but I'm drinking like down to 1 cup of coffee a day. But I have to say, I have found a good coffee replacement that is made of tea. So I'm still caffeinated and advocate, that still works for me. It's still there. I actually have just launched a new design that I don't have a picture of myself in yet, but it's I won't be quiet, so you can be comfortable, and then it has the advocate like a warrior on the back of the shirt.
We'll definitely have to share those links to the store. And I just love these comments. It's like, Jenna, you're so amazing and such a beautiful woman. I love that Lupus Spoons is jumping in. So it's like, now let's spread this out even more. So this is definitely great. And we have surprises for some of the people, although I'm going to let Estella, who likes this part of the show, maybe give us a question for people, because so it's good that everyone enjoyed those love handle grips, because that's what I was gonna have as the prize giveaway. But we need a question, Estella. So if people out there,
that was my question. I was gonna say, what was it called? It's okay. I know, right? I should have said the private chat.
Oh,
I know. I love that you're putting it up there. I had no idea, Jenna, by the way. I had no idea that you had created that, and it's amazing. But let's see. Let me talk. Let's see. What question can I ask? There's just so many things that she's done. Okay, so I know. So what is it that Jenna was talking about about a policy that she wants passed and she will celebrate? So what's that? It's like a 2-word or 1 word. It depends how you say it. What is it that we're trying to pass there in Massachusetts and here in California that's going to benefit everyone?
That's a really good question.
Because we'll see if you were paying attention.
Yeah, so we're definitely, we have to figure out how to get any of these. So this is like US based right now for the giveaways, but if anyone, I don't know how to do it internationally. So
Monty got it. Step there.
We need to take her to Vegas because she's just like cleaning up. I appreciate her so much. We need to like get her on to this. So, okay, there's a link for purchasing too. She just chimed in as well. But we're going to get some of these from Jenna because we want to give them away to our people that have been supporting the Impact Tour and anyone out there. So definitely keep posting and sharing. I know we are over our time, but this is why,
but it's been fun.
I'm sorry. I talk a lot. I'm so sorry.
So do I.
No,
Trip.
I don't want anyone to apologize for that, because the great thing is like we're highlighting your work, and then we're talking about advocacy, which ties into everything that even our community is going to do in May all together, because we're doing the virtual like Fibromyalgia Hill Day in May, and we need to like bring fibromyalgia, like people need to get involved. Like we're struggling to get people involved. So I want people to be inspired by all of this. Look at the changes that you can make to all our fibromyalgia warriors out there, please. So that's why this is good. We're having these conversations. I wish they could be in person. We'd be having like tea and coffee and snacks and avocados galore. And we'd probably talk for hours and stay up late. Who knows? Slumber party time. But it's been So awesome to chat with you. Before we leave, Jenna, where can all our friends find you on social media?
I am at the Jenna Green, green like the color. I mostly post on Instagram. I've kind of tried. I've kind of like just focused on one platform over this past year. You know, there's a lot going on. So I mostly post about advocacy and life with MS on Instagram. I definitely overshare. If you want to hear about my colonoscopy, I posted there about that too. So, you know, I mean, sometimes it is just a cute picture of me and my dog. Because I mean, you know, not everything revolves around MS, but I also talk about walking my dog with MS and prioritizing that and trying to figure out, the best exercise work for me and not for everyone else, because, you know, we're not all the same. But I share like my favorite tips and tricks and answer questions and things there. So Instagram is most definitely my favorite place to connect, but on all the platforms, I'm Jenna Green. Because Jenna Green was taken, and now it's some just hilarious jokes that I had to add the because I'm, you know, very full of myself.
No,
I mean, what can I say?
That's what we have to do.
This, Jenna Green. So you are the Jenna Green for us, the amazing Jenna Green. So I'm just so excited that we had you on. We've learned so much. You know, we've learned about everything that you're doing locally. I'm so excited and glad that Melissa thought of, you know, doing this road trip and inviting us along, because we are getting to know so many other people. We're shining the light and seeing the impact that you are making. They're not just there in Massachusetts, but nationally. It's really amazing to see. So I thank you, Jenna, for joining us today, and hopefully everyone that is watching can also follow us to our next pit stop. It's going to be a Twitter chat, but we're going to be on this Sunday with the Lupus chat team, and we're going to be addressing food insecurity in our chronic illness community, which, you know, a lot of people may not know this, but, you know, it's food insecurity is bigger and it impacts more people than you may think. So I hope that, you know, everyone joins us then, but you know, I'm just glad that we had the Jenna Green on today.
I know, I love that.
It is truly my honor and pleasure to be here with you, ladies. I so admire all of the work that you do, and this is the coolest road trip I've ever been on. I'm so like fangirling, and I don't use Twitter a lot, but I will totally be there on Sunday because that is a very important topic. I love what you guys are doing and sharing, and you know, we are all in this together. You know, we're all different. Our diseases are different. Everyone's, you know, a little bit of a unicorn, right? But together we can make so much more of an impact and know that we're not alone and support each other. And, you know, you share resources, share where, you know, the local food banks are and things, and donate when we can, and pick up from the banks when we need to. And there's no shame in that. That's a very important topic. So I will totally be there. I'll put it in my calendar. I'll turn on my Twitter notifications, maybe. I'll just set an alarm, because Twitter notifications stress me out. Okay.
It goes really fast and really crazy. But, you know, I just thought of something right now when you're saying, you know, about all of us and we're all in this together. I am so glad that we have way more in common than just our inflammation. Because yesterday I was watching a Scripps Research webinar about chronic inflammation, and they were talking about, you know, how inflammation triggers and everything. And, you know, they gave examples about MS, and, you know, they didn't talk about lupus so much, but I know that that also triggers a lot of the stuff. And for us with fibromyalgia, so I'm just glad that we have way more in common than just our, you know, chronic illnesses, our chronic inflammation. And it's been fun. It's been a fun road trip. I never thought I was going to go to Massachusetts this way.
Well, you always have a place here, and I am a huge fan of California. So one day I'm going to truly visit and super loudly probably scream with excitement and then very gently hug you.
Yay, we'll pick you up in our Sprinter. We'll have to, or like RV, according to Crystal. It'll be a lot of fun, and I appreciate your time and joining us, Jenna Green. And I did add the link to Instagram so people can connect with you. And it'll be fun to visit you in person again, like go see you. And I can't wait to meet Dixie. I definitely want to give Dixie a belly rub. I just, I love dogs, so it's a big thing.
She's sitting on the bed waiting for one right now. She's been a very good girl. She wants to meet you too. I feel like I know you. Like, I always joke that all my friends live in my phone, but I feel like we, already met and hugged, and you just live in my phone. That's all.
Yay.
But thank you. Thank you so much. This was great.
Thank you everyone for tuning in. So yes, please join us on Twitter on Sunday with a special Lupus chat on food insecurity. And then we'll be back next week with some more surprises too. Thank you for watching, everyone. See you next week. Bye.